Start with a short. Thank you. We'll start with a short intro from each one of you. We'd love to hear have your LinkedIn pages as well as the dot on the world map. It's all very interesting to see how well we are represented within this room. And then Cesar is going to introduce very extinguished guests that we have today as expert speakers. They'll be providing their insights on what they think on where we are in the transition. Then Joss is going to lead us to map the transition. It has some really cool frameworks that will guide the conversation throughout this exercise. I'll be coming back with walking through blockers and enablers, kind of what is blocking, what is slowing us down, what is giving us a bit of more of a tailwind, and where could we move next? And then we will conclude the session. So 90 minutes we will spend together. Your role, I always like to say, every single person is in the health system. So this is the opportunity for you to live that as well. Whether you're a policy expert or practitioner or someone who's just wants to do something good in regard to the health system transition, you're very welcome, and we need your voices. So we'll get started. Below, so in the chat, there is a Miro board link. It's being shared at the moment by Roma as well. And as soon as you get on the Miro board, you can see at the bottom a world map. And there are a couple of dots in different colors that you can drag and drop on the world map. So feel free to start doing that already now so we can see how you are, where in the world you are. Yes, and maybe with that already, while everyone's great to see so many changes already, awesome. I would love to hand over to Cesar now to introduce the speakers of today and start the conversation. Thank you.
Thank you, Ushma. Perhaps we can zoom in the map before that to see where we all are. Thank you, Roma, for helping us with this. So I'm really happy to be here with Ushma, Joss, and have worked with this with other folks from the Systems Innovation Hubs in Health and Social Hub. Me myself I have worked in different projects from health care servicing to projects that are connected with health across different countries. So it's always nice to discover where people are not only geographically, but where they are in the way they connect to health. So we have already people from the North Americas, from Europe, from Asia. Wonderful to see. Keep populating that. And if you can, place the LinkedIn profile in your name. It's always nice to also place you in your practice. So having said that, we wanted to understand a bit more from different perspectives of or different approaches to health and healthcare. Where are we within this transition? So we invited a couple of folks to share their experience with us. And since you might see not only from the map, but also perhaps from some of the speakers, some of them, they are in time zones where this is a little bit of an uncomfortable time. So they might be with us, or they might have failed to join us because of that. They did warn us. But some others are either between travels. So I want to make sure that we have all of the fantastic folk that we invited to share sort of a bit of their experience and their practice in healthcare. So we have, I see Yak Fan is with us. I haven't seen Joanna, Julia, or Jonathan. which I hope might be joining us in a moment, but they did warn us that it would be hard for them to join. Um, so why don't we start with you, Yuck? Would you mind saying hi quickly?
Sure. Hi everyone. I'm
Excellent.
Yokan.
We can see you now.
Yeah,
So
can
thank you
you?
for joining us, Yuk. So as you can see here in the small synthesis that we shared from all of the people that we have invited to share a couple of words about their approaches. Yuk focuses on health system transformation, population health architect. He's a board and global advisor, and he has delved deep in systems thinking. So thank you for joining us, Yuck. And we wanted to start this conversation with a very simple question, right? So, what do you do that it's connected to health? Riveting complex conversations, questions. But we wanted to start with that for you to share what are you doing, and then if you could connect it to why do you feel you're doing has a systemic approach, which is what brings us on board to our conversation today.
Yes, certainly. Thank you very much, Caesar. Is that the correct way to pronounce your name, Caesar?
Correct. Thank you. And am I
Very good.
pronouncing your name as well properly?
Yes, Yoke, yes. Hi everyone. Yeah, so thank you so much for the introduction and for inviting me, Josh. Very happy to do this. I'm a public health physician. I practice as a medical doctor for about 10 years. But for the last 25 years or so, a significant amount of my time was spent in trying to improve healthcare services for people. And in the last 12, I have been working with hospitals to transform them into population health systems in the north of Singapore. I've been trained and I grew up here in Singapore. And as with a lot of the healthcare systems around the world that you guys might be familiar with, we are very much a disease-based sickness care system. And the health part of our healthcare system is essentially public health, basic sanitation systems, food dietary systems, quality control systems that they don't really work very well as side by side together to create a whole ecosystem for health. Um, so, so the government of Singapore for the last 10 or 15 years or so has been actively trying to rebuild that ecosystem, to re-emphasize prevention, to re-emphasize whole systems approach to health and well-being that will minimize disease as much as is possible, even though the work of disease treatment continue to be important, right? So I think it's a kind of a titration of that balance between how each of those disease care systems and health and well-being systems relate to each other. And in that regard, when I started the work of transforming my hospital system into a population health management system, the idea was in infancy, and certainly the method on how to do it was even more nebulous. Yeah, there was an idea of what to do, but how do you go about changing the mindsets of people? How do you go about recalibrating all the support systems? And by that specifically, I mean the financing system, the manpower system, your logistics systems, your IT systems. There wasn't a lot of clarity exactly how do you go about doing that. And so in the last 10 years, my work has essentially been trying to do that for the northern regional population health system in Singapore. So the regional system cares for about 350,000 people in the north. And before this repositioning, we were essentially waiting at the doorsteps of the hospital, waiting for people to come to us and for us to care for them when they fall ill, right? But the idea here was to reorientate from a reactive system to caring for 350,000 people, maintaining their health and well-being in partnership with all the other providers that are in that community ecosystem, whether they are a voluntary, non-governmental organization, whether they are private entities, private organizations, or whether they are social care and family support organizations, and what we call non-traditional healthcare organizations, right? So it was first things first is to reorientate then that whole system to be able to embrace prevention. And then secondly, working beyond what I call non-traditional disease care partners. Yeah. So finding out what to do has been tremendously challenging because there's no playbook around how to do this. There is no guidance from the Ministry of Health. How exactly do you transform a whole hospital system? So I set out to figure how to do this, and that's where I get to the systemic part of the work because I think the most important thing, and I've learned this over the last 10 years, is to first articulate how would you like to care for that population. And by that, I mean coming out with a model of care that is what people need rather than what you want to supply. Now think about that. Right? What do people need, and what is a care model that represents their needs will become better over time, their health needs will reduce, and then their health will be optimized? What does that mean? So I think we have lots of supply-sided disease care models that are institution-based, profession-based, that are disease-based, right? But we have this lack of what we call a person-centered, needs-based, value-based care model that looks at how and what people need over time at various stages of their life. And then how do we reorientate services from different providers, integrate those services across institutions and boundaries, and then meet people's needs for different time boundaries, right? For a 1 year horizon, for a 90-day crisis horizon, right? And then we could be working across all different institutions and then meeting that need as one system. So this is the first systemic part of what I think, right? A hierarchy of systems of care that together envelop a person from cradle to grave and then customize using population segmentation data. So we really know who we are caring for and what their needs are, and then reorienting our supply-sided systems to care for them. Yeah, so this is the first piece of major work that I've done, and it's published. You can look for the unified care model, and it describes the design principles of how to meet people's needs. And
Thank you
then,
very much, Jörg.
yes.
I'm so happy that I made this simple questions, two very simple questions, because I knew that the response was going to be so robust. Because I think you very well and very detailed you very well detailed the challenges of the whole process of approaching health from a systemic perspective, you know. So before deepening on a bit more on your experience, I wanted to offer also the chance to another of our guests that is going to launch our reflection today to share a bit on her practice. We have together with us Julia Sonetti. If you could quickly say hi, Julia, so I can introduce you and people can see your face in the
Hi.
video.
Hi all.
Thank you very much. And I know you're
Hello.
joining us from the airport, so thank you very much for your flexibility. So Julia is a postdoctoral researcher at the Barcelona Institute for Global Health. Julia sits at the crossroads of mental health, sustainability, education, ecologies of care, and human-nature relationships. So again, it's a very complicated question that we wanted to ask all of you, which is, what do you do, and how does it have a systemic approach? So perhaps you can share a bit about that.
Yeah. So thank you for the invitation. And sorry for for the setting here. I'm in the airport in between flights. So I would be able to stay for another half hour, I guess. But it's really important for me to leave here some seeds of reflection. So from my point of view, I'm a researcher. I'm a Marie Curie postdoc fellow at the Institute of Global Health, the IS Global in Spain, in Barcelona. My work sits in between mental health, sustainability, and education. In particular, I focus on climate anxiety of young people, emotional well-being, and what I call those ecology of care. Yoke was mentioning the word care many times, and I was really glad to hear that. Because today we all, I think we can offer a perspective that complements system thinking with something that we often overlook in the health transition, which is the inner, the emotional, and the relational dimension of this change. So when we talk about that, especially towards a systemic approach to health or healthing, no, because it's already a shift in the language, I guess. We are moving from health as a rigid and static outcome uh, to health as a process, as a practice, but more as a relational outcome. And this is exactly what happens at the sustainability transition level, which I'm more expert, of course, because I come from the sustainability science realm. So this resonates deeply with the challenges that sustainability science faces nowadays, because we are not only dealing with infrastructure, policies, technologies, but we also deal with values, with the behaviors, with cultures, and importantly, with emotions. So we sometimes forget when we look at the multi-level perspective, how did we get to here? Because we often, or at least more easily, uh, like get in touch with what we are witnessing now. Um, sorry for the sorry for the voice of the baby goats. Welcome, they say. Um, sorry. Anyway, so my point is that sometimes even exposed to the news nowadays, now we are currently living in a moment that, yes, we know that is made of overlapping crises, now the climate crisis, the social fragmentation, the mental health crisis, and especially among young people, we are constantly witnessing a rising level of climate anxiety, eco paralysis, loss of agency. Those are not marginal to the health crisis because it's a feature of our time, no? The uncertainty. So this is at landscape level. When we go down into the regime level of it, so the current health system also still largely present characteristic of other regimes, now the climate regime, the technological regimes, which are reactive rather than preventive, as also Jörg was saying, individual focus rather than relational focus, and biomedical rather than socio-ecological. So you can see also in the kind of scholarship you can get or the financial aid you can get. Now, if you say the magic word digital health, everything become easier. When you focus on something relational that almost has no cost, just the cost of the time getting together, immediately lost interest, not for those who are seeking money for like accompanying this transition in a more relational way. Also, mental health sometimes gets attention only when we treat it as a pathology, but actually, I mean, climate anxiety is a sane reaction to an insane system. So it's not by using benzodiazepine that we can solve the current crisis of mental health. Instead, a collective and systemic response to real world condition is a regime level response that could foster a transition, no, towards system approach. Last but not least, the niche level, because that's where I position my work. I'm not working in big companies or big politician corps. I'm a researcher, so I work through a project that is called Cycling to Care, which is my Marie Curie project. That is an experiment with nature-based intervention, intergenerational encounters, and embodied and relational spaces that can foster reflective and collective learning spaces. Also to welcome grief, because sometimes there's no such a solution for those crises, but sometimes we just need a space to grieve together. So those are small scale intervention, but I try to prototype different way of doing things. And probably a key insight I wanted to drop here is that I do that from the university point of view, not from the hospital, nor for the public health authority point of view. Because I think we cannot achieve systemic transformation if we are not starting from inner transformation. So the inner transformation, I don't mean that should be necessarily individualistic or detached, but I mean to reflect together how we people relate to ourselves, to the other, and the environment. So the planetary health concept is very much related to inner health and community health. So if someone feel overwhelmed by climate anxiety, there's a big risk of disengagement, especially in young people. No, the eco-paralysis lead to lack of self efficacy, no, the lack of agency, active hope, as Joanna Macy would say. So probably emotion are not secondary here to tackle the approach to systemic transition to healthcare. And from this perspective, there's something I describe as blockers from my research. So fragmentation is one blocker because we are still separating like the mental health, the physical health, the environmental health, the community health. But in reality, they are deeply connected. We talk a lot about social prescribing or nature-based therapy. So those are becoming more and more legitimate in terms of health system. There's also a lack of safe space to process those emotions, especially in institutions. Again, they
This
say
is this is
to
this is fantastic. Thank you very much, Julia. And precisely this is part of the intention of having your experience and having Yok's experience, its complementarity into deepening on this different perspectives and different approaches towards the transition from a very isolated or individualistic or siloed practice to a more systemic practice. So I think it was wonderful to listen to your Yot's approach to from a very sort of healthcare system systemic perspective towards more addressing prevention outside of the healthcare sort of infrastructure to your perspective that comes from the other direction, right? Which is very interesting. Unfortunately, we will not have neither Jonathan nor Joanna today with us. They both have situations that they had to attend to that we just communicated with them. But I'm really grateful to have both Julia and Yok to start us with this reflection, which I think has already been very rich. And now we were all going to be able to continue this reflection through the transition mapping. And I'm going to sort of hand over the microphone to Josh so he can explain a little bit more about how we're going to go through this.
Excellent. Thank you very much, Roma. Thanks for the others for sharing their thoughts and insights. Hopefully you're seeing my screen with the canvas on it. Is that correct, Roma?
Yeah.
Yeah. Okay. So Julia just talked about it, the multi-level perspective, which is a model for thinking about how change happens within complex systems, particularly transformative or systemic change, and how one way of organizing, one paradigm to a system can become disrupted and displaced due to macro changes in the environment. Sorry, 1 second. And this can happen through niche innovations, as Julia was saying, rising up. And those can break into the regime and disrupt it through these landscape changes. So just to zoom in on all of that, When we talk about a transition, it's something that plays out over time. It's a macro change to the system structure. It can happen in all kinds of systems. We can think about going from being a child or a teenager to an adult is a form of systems change when we reorganize ourselves, our lives, our way of looking at the world, our values, and what we pursue. It's a type of transformation, and it plays out over time. And we can identify a number of different stages in that, right? There's the present, and there's some kind of transition period that's leading to a future state that's going to be different from the present. And the story is going to play out on that canvas, on that time frame. And in that time frame, on that canvas, in this story, there are at least three dimensions that you'll find in transformative change. One is the incumbents, right? So when we talk about systems change, there's always an incumbent system there. We're not starting from the beginning. So this is the current way of doing things, the existing institutions, and the way that resources are currently organized to fulfill the function within society. It's an institution that's organizing this way of working. There are drivers of change, which are the macro level changes within the environment that are necessitating change within the system and creating opportunities and creating challenges also. And there are new innovations, new practices, new ways of doing things. And all of these will be present in all kinds of transitions. So over time, the idea of a transition is that the incumbent system is no longer fit for purpose, and macro changes will necessitate its change. And within that change space, there is an opportunity for new practices, new ideas, new values to enter, develop, and grow, and potentially change the system towards a new way of doing things in the future. And it's called multi-level because it looks at this change process on multiple levels, right? The big macro environment, the landscape, and within that we have the system and the current ways of working, the institutions. But we also have these little niche innovations, new innovations being introduced, which are potentially better fit for this new context and able to harness that the energy and the potential of the new environment, the landscape changes. So that's a little bit how the multi-level perspective is working. The landscape up here, overall macro environment within which major changes are happening, like the rise of chronic diseases, or the fall of antibiotics, right? Antibiotic resistance, or the rise of pandemics, for example, or changes in societal values and thinking around health and well-being. These are all macro changes that are creating a different context in society and economy within which health systems exist, and that's the regime, the current and persistent configurations and patterns that are the dominant ways of organizing that system. And then here are the niche, which are still on the margins. These are the new innovations, new practices, new ideas that have the potential to change our way of doing things in the system. And of course, there's a change process. Time is going forwards, and the landscape is disrupting the regime. Antibiotic resistance is going to disrupt the way we do antibiotics, right? And that's going to play out over time. Aging society is going to disrupt the way we do aged care. And that means the regime is going to bump up against some challenges here. And it's going to have to change, or new innovations are going to have to be introduced that are better suited and adapt to this new way of working. So the landscape changes up here can create a window of opportunity that disrupts the incumbent and enables the innovations to develop and grow, and potentially form a new system over here if they're able to gain traction, if they can be nurtured and developed, if they can be connected, if we can enable that transition from the old to the new in some way, then this can be a pathway to systems change. So that's the multi-level perspective. It's a model used for representing processes of systems change in many different systems. Today we're talking about healthcare, and we're going to use it as a platform for sharing our ideas around this. Here's the canvas you see in front of you. It has all the parts we just discussed there. You'll see 7 boxes, and we're going to divide it into 3 sections now. At the beginning, we're going to ask about the landscape changes, the incumbent system, and what are the new innovations are. We're going to have you share your ideas. And then we'll go to center section where we're talking about what we think the windows of opportunity given those macro changes are, and how could the new innovations disrupt potentially the incumbent regime um, to move into the mainstream, become a more dominant way of doing things. And finally, Ushma is going to walk you through a set of questions here about the opportunities and the blockers and enablers for this transition. So that's that. I'm going to put some time on the clock here for us, and I encourage you to join on the mirror board if you have not done so already. You'll find stickies here, or you can grab them from the side also and drop them in. Hope you're familiar with Miro. Try to keep them to an appropriate size, and I want you to try and answer the questions. So we're going to be taking 3 questions first. On the left-hand side here, we'll do them all together in maybe 10 minutes. I'll take a look at the time in a minute. The first question is, what are those landscape changes that are actually going to drive change here, that are necessitating changes in our way of working, our way of doing things? We already discussed, well, I mentioned, antibiotic resistance or aging society, things like this are actually macro level changes that are going to change the whole context. There are others, and that's what I'd like you to reply to. What do you think those major changes are that are going to lead to, important changes in the system? Also below that, once you've done that, we're going to look at the regime. What is the current way of doing things? What are incumbent institutions and practices, and what are the structures and values that underpin them also? With the current way of doing things. And then down here, what are the new innovations you think that have potential, that are reflective of a new set of values, new set of ideas, new ways of doing things that actually have the potential to disrupt the regime and form a new system that is aspirational, the one we'd like to see coming into the world and is actually transformative. It's built on different values, different ideas, and so forth, different ways of relating, some of which we already heard about. So yeah, we already had a few ideas from the speakers there about what the regime looks like, what the innovations look like, and so forth. We're going to take let's say 8 minutes now for you to post up your ideas in those 3 boxes. Hopefully everything is clear. Maybe you want to start at the top of the landscape, move to regime, and then down to the niche. But we will do a little bit of whacking here to post up ideas before we come back and look at them. So some music and a bit of time. If you have any questions, if anything is unclear, you can ask it out or put it into the chat. Yeah, you might want to move on to the next section, incumbents and new innovations, so that we cover all of them. Great. So let's take a look at some of these. Landscape changes. I'll maybe call on Ushma and Cesar if they have any ideas we might have missed here, but the poly crisis, AI stop, housing costs, ideology supersedes evidence, healthcare is no longer safe to practice, anti-intellectualism, ideology supersedes evidence, yeah, fractured global order, movement from health to wellness, policy changes, tech advancements, tech dependencies, outsourcing to KPIs. Anybody want to talk about this one? Outsourcing to KPIs? Whoever posted it?
Yeah, hi, this is Gatory. So the outsourcing of KPIs, for example, like where I'm based in the US, right now we are trying to, most of the healthcare system, because it's very expensive, they are trying to outsource in over offshores, for example, like, IT and, different, departments. That's why there's so much volatility in different markets in the healthcare system.
Great. Movement towards health well-being, legal cost provider protection, AI bias and lack of diversity in training models. Yeah, Caesar, Ushma, anything you'd like to add here?
Yeah, I really love all of the contributions. I think polycrisis sums up quite a lot of what is being described there, but we can see the different layers and the different sectors of where these changes are happening and how interconnected they are. And one thing that I think in health is also perhaps a bit related to the fractured global order is the funding structure is changing, right? The US, for example, stepping out of the WHO, it is changing the way aid has happened or the development structure. I think that's also something that is causing a lot of change in the landscape of health as well, but also, of course, the full environment as well.
I think one thing that I notice is that the landscape changings are overwhelming, I, I think there's a lot of very meta and macro concepts here, there's sort of a lot of elements that are very punctual, but also very systemic, but also very structural. Like polycrisis, it really speaks about the crisis, the multiple crises that we are facing, but also perhaps about the way we understand the crisis, right? It's difficult to navigate and understand all of this concatenated and consecutive crisis. So I think that's very interesting. And also the role of technology in making things more complex. Should we go to the next, Joss?
Yeah, I will do. So, what's the incumbent regime? Lack of healthcare providers trust, Medicaid, Medicare reform, lack of health literacy, the way we've always done things, lack of follow-up post-interventions, lack of centralized data and pass-off or bad pass-off, poor communication across silos and to prevent and patient caregivers. Science of medicine excluding art of medicine, financial motivation, overburdened doctors and clinical administration as administrators. So that's the heroic doctors here also, right? Administrative blockers, prior authorization, etc. Distrust of health profession, accessibility for all aspects, privatization, chronic underfunding, lack of data governance and sovereignty, dollar dependency, work in silos, poor execution, not involving reality in treatment plans. And do you want to talk about that? Lynn?
Yeah, just remembering to turn the audio on. I was having a lovely conversation with myself for a moment there. Apologies. I've just finished a project on patient experience for one of the US health systems. And oh my God, the inability to look at the whole patient and what their reality is, as opposed to, what you're prescribing or they should do next, could bring you to tears on a daily basis. So it's treating the disease, not the person, on a basic level, as opposed to really figuring out how you can ensure that they are able, based on all kinds of factors other than their disease, their environment, and so on and so forth, their family situation, uh, before you release them from a hospital system and, wave goodbye and hope for the best. It really, anyway, really, really
Yeah,
struck me throughout. I'm not saying
it's
we're
kind
any
of
better in Canada, but because I think it is a endemic, that particular
well,
issue.
yeah, it's an inability to see the whole of the person and respond to that. And like straight away, the thing is we divide it up because we've got all these departments, don't we? And we put it into all those boxes and we totally lose sight of the whole. And that's like classic kind of reductionism, right? We break the thing up until we've lost sight of, the most important thing, which is the person and, their whole reality of their life. Okay. Anybody else? Yeah, Susa, anyone, Julia, anything you'd like to add to this section about the, current way of doing things? I mean, episodic care says a lot.
I think it reflects very well with what both Young and Julia started us with, right? I think this is a more detailed and aligned uh, perspective of what they started mentioning from their different spaces. So yeah.
Okay, great. The way we've always done things. Yeah, there's a lot of fear, isn't there, of malpractice and all of this. Is yeah, it constrains a lot of ability to respond like a human being and adapt and innovate, I think. The kind of legal side of it and responsibilities and so forth. Yukfang, is there anything you would add here? Or anything you'd like to add, Yukfang? Does this sound right to you?
Yeah, I'm just processing the many post-its. I think it's a very rich amount of data. I suspect our different contexts are quite different, and there's a lot of nuance. Um, Certainly, I see many things that are very similar to what my system was going through. And but the I think the point on about what we can do, with all these incumbents, right? They are actually in many different systems layers, and they're kind of all overlapping, and it's like a whole plate of spaghetti, and every system is touching every system everywhere. And you've got to kind of like have a way to take a look at all these incumbent regimes, and kind of know where are the leverage points that really can get you into the system with a bunch of energy that you can work with, and then from there start spreading out and building some sort of momentum. Yeah, I think that's kind, and that will be different for different contexts and different systems, right? So if you're in the NHS, it's going to be very different. If you're in Japan, it's going to be very different. If you're in Singapore, it's going to be very different. In Canada or in the US, yeah, yeah. So I'll just leave it at
Yeah.
that because I don't know the individual reference context. Yeah.
Sure. I mean, it's highly institutionalized, and as you say, you've got to find the right way into that, and the energy and momentum and so forth. Okay, let's stay going for the sake of time. What are the new innovations? Virtual care, clinics, indigenous-led health, two-eyed seeing. Okay, I like that, two-eyed seeing. Housing projects, social impact bonds, AI workflow automations, social prescribing. Anybody want to talk about that very briefly?
Yeah, that would be me. It's about social prescribing has, to be honest, I don't know where it started, but it's becoming something very, if I may say, trendy, but it's in a good way. It's trying to alleviate the burden on staff within healthcare systems to bring them outside. I think it's touching upon a lot on what was spoken before on non-traditional health providers. So it's really about trying to take the burden a bit outside of the healthcare system. There is a global social prescribing alliance that is trying to that has also got some access to funding as well on programs. And in the UK, it's in the UK system, it's very prevalent and very fashionable
Great.
now as well.
Thank you very much. We're going to have to move along swiftly for sake of time. I put up a few ideas here. Also, well, healthing is one idea, right? Turning this into a verb, a thing you do every day, as Julia said, instead of kind of an outcome. Also, complexity science actually is a huge thing here because so much of how we think about health and the whole medical world is a lot based on modern science, and that is highly reductionist, and that constrains it in so many ways, right? The way we think about medication and so forth, and it's not open to non-scientific ways, So, but complexity science is a science, so it can actually present a post-Newtonian or post-reductionist paradigm that can really expand our view of health and people and well-being in a way that is actually scientific, and is accepted within the scientific community and so forth. Also, full cost accounting in terms of health can be considered in everything, right? How we build buildings, how we organize schools, and how we do, food and all of these things. Okay, I love, we'll try and stay putting ideas up there as we go along, but do need to move along. We just have half an hour left. So coming to the center here, where we're talking about the actual transition part of it, and there's two sections here. What are the windows of opportunity? So these big landscape changes, they create challenges for the incumbents, but they create opportunities, particularly for the new innovations who have been able to see those changes coming and say, I want to build for that new world. And if I can do that, then I can really harness this energy, this momentum, and enable some disruption here. So the first one's around what do you think those windows of opportunity are, driven by these macro changes? And secondly, how may the new innovations disrupt the incumbents? What might that look like? So I'm going to put maybe 6 minutes on the clock here for you people to post up some ideas, and we'll come back and have a conversation afterwards. I'd like to move down to the second question. We've just got 2 minutes left. Okay, taking a couple of minutes to look at this, the windows of opportunity, portfolio mission orientated innovation. Yeah, that's interesting. Never heard about that in care. Mark, would you like to share anything about this?
Sure. Hello, everyone. So this is an orientation that we're introducing where we are within Alberta, within our healthcare system. We had a provincialized healthcare system like NHS in our province, but it was recently dismantled and turned into four separate organizations with four new health ministries. So we have that sort of formalized fragmentation within our healthcare system. Um, the organization that I'm with now looks after the acute care sector from a governance and oversight perspective, which is new because it introduces a level of accountability to our hospital systems and acute care sector. But the thing that seems to be missing is a coordination or a mission orientation, a portfolio-based approach to how we solve a lot of these shared challenges that we see in our context, like extremely high ED wait times, surgery wait times, poor patient flow, and so on.
Could maybe be down here and like a way of disrupting the incumbents. I'm not sure if it's a window of opportunity because yeah, it's a way of kind of connecting across the fragments and doing things differently, I think. Yeah.
It would require sort of a dismantling of that sort of siloed territorialism, that sort of legacy mindset when we think about how care is delivered.
Yeah, yeah, that has to kind of connect across them to some extent, maybe build upon them, but also kind of overcome those challenges. Okay, let's dig on local business. Thanks for that, Mark. Local business development, affordable housing, innovative financing models. Yeah. Any quick words on that? Any ideas around that? Innovative financing models?
Yes, that was me, Joanna. Um, I think I'm dealing with prevention, and I think there's a financing logic mismatch at the moment because prevention creates long-term value, but systems operate on short-term budgets. And so that is very problematic. And I think what I've been pushing for with some of the work that we're doing on European projects is a new financing logic. And it's not necessarily about new money because there's not lots of new money around. That was the way we thought about things in the 80s and 90s and the early 2000s, but it changed. And I think this is where approaches like smart capacitating investment coming, and Ushma has been is familiar with this because I introduced it at the Radical Health Festival. And smart capacitating investment is not a single solution, but it's a new way of aligning resources, risks, and incentives across the system. And within that context, I just want to go back to a point that Mark made about health systems. The way that I look at it is that healthcare exists within health systems, and healthcare is only one of the provider platforms within a health system. And health systems it cuts across housing, it cuts across business development, it cuts across education and other sectors. And I think we've got to start looking about where we've got to look at health as a function and not where the budgets flow following
Yeah.
institutions. So,
And then maybe, yeah, being able to unlock finance across those other systems also is maybe what you're saying,
yes.
that instead of looking for more money. Yeah, okay, great. So I do need to move on for the sake of time. Thanks a lot for that. Education, personal tools, apps, wearables, philanthropy moving from names on buildings to outcomes. Okay, great. Media interest in health is high. Yep. Yeah, and I think that's part of the healthy idea. Like, there's so much money and interest in well-being, and the whole wellness. And how do we integrate? That's another way of kind of unlocking finance, isn't it, Ushma? Like that whole industry that seems to be separate from the scarcity mindset of healthcare. Okay, co-creation and self-determination. Great. Would love to unpack that more, but I'm not sure we have time. Move towards self-sufficiency and sustainability. So those are some of the windows of opportunity, and moving down to how how these innovations could disrupt the incumbents and what that might look like. CBOs partnering with health systems, reimagining care management, local business emergence, portfolio mission-oriented innovation. We brought that one down. Increased productivity and efficiency, informal networks and coalitions formed to address shared challenges. I put in a couple of here. I mean, the pandemic was a crisis, and it also led to opportunities, new ways of doing things, and so forth. And essentially just providing solutions that work, right? Whenever this, like the NHS, when it doesn't work, that creates opportunities for providing things that do work, like telemedicine can come in and, fulfill those functions, or in places in the world where healthcare is not accessible, then you can come in and, provide different ways of doing things. It takes a degree of entrepreneurship, but it's an opportunity also. So, yes, I need to stay on track here, so I'm going to hand it over to Ushma, so she has a bit of time to walk you through these final two sections before we'll be back to Caesar again. Yeah.
Perfect. Thank you so much. It's only two core questions, and we've seen so many innovations and so many a lot of windows of opportunity where these innovations can thrive. We want to dive now a little bit into what do we see could be some challenges, what are some blockers that are hindering us moving towards this new system and paradigm. That's the top block. And then the bottom one is how might we enable these new innovations? Are there things that we can do, or perhaps things that are already happening that are shining some light to these new innovations, that are providing a platform for these to illuminate these innovations? And they can range from different things like positioning or branding it are new, right? Like healthing, for example, or social prescribing, for example. But it's or it can be about creating networks and illuminating each other's work and different case studies. So maybe, I don't know, just 6 minutes?
About that, yeah, maybe
Then
6, yeah,
6 minutes, 3 minutes each.
great.
Maybe we can take some time to move to the second one already. perfect. Thank you so much for all of your contributions. It's funny because I see a lot of things from that are coming from inner development goals, like a lot of personal the way we see things as obstacles to systems change. So we see here greed, inequity, persons' interests, no real agreement, like definition, I think more, no real agreement on what health is and how to achieve it, dependence on reductionist science, political ideology, risk tolerance, no perception of the burning platform, structural transition failure, protectionism. So lots of things that are coming from the way our mindset works, but also elements of funding constraints, structural items as well, lack of incentives, no shared language, yeah, so great to see a couple of, I mean, not great, but we see a couple of blockers, but I think things that we can manage. Can we move to the, or any thoughts? Maybe, sorry, any thoughts, any additions? Anything that we're missing from anyone?
Inequality is an interesting one, isn't it? Like, because it means the people who need it often don't have the money, or we don't have the money for things that are needed because it's being kind of sucked up somewhere else. But yeah, so it shows how interrelated it is with many other systems, doesn't it?
Mm.
Maybe we stay going here just for sake of time.
Yeah, sure. So the last part, it's always good to end on a bit more of a positive note on all the things that we can do to enable these different very exciting innovations, of course. One is leadership team development. Again, financial incentive structure. If we can address that, then of course it addresses directly the blocker related to it. Consider societal changes, centralize a best practice library to quickly roll out successful pilots, very interesting. Awareness, build competencies, lots on awareness also around complexity. And I think this is maybe for you also very common, this co-creation and collaboration need. After a lot of meetings that we have, then we end up with, okay, we need to collaborate now. It's very clear that we need to build partnerships. That's always how events end, and clearly that's all how ours is going to end as well. Embracing like open-mindedness, embracing other worldviews on health and well-being, interoperability, also co-creation, participatory design. Yeah, perfect.
Okay, so maybe we move along. Thanks for that. Cesar, I'll pass it over to you.
Thank you. So this session has been incredibly nourishing, and we're very grateful for your participation. And again, to nourish the paper that is going to come out from this conversation and how we have deepened in the systems innovation, both health and social hub, we wanted to ask you sort of in more this view of going towards a more systemic approach to health. What do you think are where do you think we are in relation to this systemic approaches, right? I see already people answering this question, and I want you to keep it in one or two words, right? So it's more of a sentiment gathering. We want you to share how do you feel in this moment.
Yeah.
And perhaps while you all do that, we can take advantage of having now with us Lauren, and I can ask her perhaps to share her feeling on this, since she was not able to share her perspective at the beginning. Can
You mean
you hear us?
Joanna? Joanna, right?
Yes.
That's perfect. Awesome. Welcome, Joanna. Thank you so much for joining us.
Sorry, I'm terrible with names. Excuse me, Joanna.
Hello.
Hi. Thank you so much for joining us. Sorry, I'll hand over back to Cesar.
Sorry, remind me of the question because I didn't think it was aimed at me.
It was sort of, if you could sort of speak a bit more about how do you feel we are in the systemic approach. So now people are populating with one or two words. You can have more than one or two.
I think the people that I've talked to about healthing are very committed. They have a mutual understanding and a shared way of thinking. But I think we have a big barrier, and that is our ability to talk with investors. And that can be both public, private, philanthropic. And I don't think there's many people in the field that I'm working with are very good at putting together a pitch for investors. The companies that I've worked with in the past are very good at doing that because they want that money for growth, for bringing a product to market or whatever. But we're very good at we're getting much better at telling the story on healthing, but we've got to give some concrete basis for it. And we've got to really try. We've got to experiment and try and do things. And there's a project which I got funding for, which is coming to a close now. It's got its closing event in May, end of May in Brussels, where we've focused on smart capacitating investment, and that's about how to invest in different ways in health promotion and disease prevention, because we didn't learn the lessons of the COVID pandemic. Everything just regressed to how it was before. And we didn't take the learning forward. Well, there was a few things that changed: remote care, decentralized trials. They're all good, very helpful, but it's not. Things haven't really changed. And one of the things that I'm concerned about is, in terms of how we're pitching, I talked in one of those boxes about the missing middle. And I think the problem that we have with healthing is that healthing should be seen. What we've got to do is build an argument or a narrative with healthing, which is about saying it needs long-term investment in the same way as transportation does, in the same way as energy does. These are, if you like, foundations for society. Healthing is a foundation for society. And so we've got to be able to do the pitch. The problem is that what you call healthing, others call precision health or prevention, financing is still short-term and siloed. Value is not captured across sectors when we want to look at a health system in as it should be. There's no ownership for scaling. And something that I think is incredibly irritating, and I've worked in public health off and on for 40 years, is that there's high evidence thresholds for prevention. And prevention has one of the smallest investments in any area of health system investment. And yet other areas of investment, they just get the money. Prevention's constantly got to pitch itself and kind of try and convince people that it's got a role to play and it's worth the investment. But we're not good at doing that because the system is not allowing us to do that. The system is structured to run in a different way. The system for health or healthcare is still a factory model. It's a manufacturing model from the late 19th, early 20th century. You have inputs, they go through a process belt, you have outputs. That's it. But that's not healthy.
That's a fantastic perspective on this, and I agree. From my experience with disaster risk reduction, we have a similar frustration, right? Because when you're approaching prevention or disaster risk reduction effectively, then bad things do not happen, and then that does not feed well to the way the system is designed currently, right? Also incentives. So this is very important. Thank you for sharing with us. I'm gonna now hand over to Ushma to wrap up this session with the next steps and an invitation for you all. But thank you again for staying with us and this fantastic nourishing that you have offered.
Yes, I'll just keep it very short because I understand we're over time already. So thank you, big thank you to everyone that has joined us today and has participated in this conversation. As mentioned, as next step, we'll be compiling and sharing all of these results and insights that you have shared together to us together in a paper. I'd also like to invite you to an event that started last week, but there are still 2 more sessions. One day after tomorrow, and then the one next week as well. It's a 3-week-long learning lab. It's absolutely fascinating. I can highly recommend it. Cesar is leading it and is talking about the fundamentals of systems innovation for planetary health. Do register and join. And then if you're all still, you can log off of Zoom, but if you can still please provide some feedback on how useful this workshop was for you. And if you have some comments, you can fill it into the stickies as well. Thank you all very, very much and have a great Thursday afternoon.
Excellent. Thank you, Ishma. Thanks, guys. Excellent. Thank you.
Thank you, everybody. Happy to see you for our next cohort of fundamentals. We will be starting the fundamentals of systems innovation for planetary health on April 11th, the next cohort. So,
so
it's
the link is here.
You're already on the Advantage group that is already part of this cohort.
So the link is here on the image. Yeah, if you click on that, it'll take you there. I'll put it into the chat now. Great. Take care, guys, and I hope to see you again soon. We'll be publishing this paper in the coming weeks, so we will let you all know about that. I hope to see you again in the future event.
Thank you.
Thank you very much. Bye-bye.